dentistry is absolutely booming right now, even through this crisis. We've seen kind of the worst of times in March, April, May, and coming out of that, we're I mean, as busy as ever, aren't we, Rose? It's amazing, the demand.
It hit March 16th. I remember I was in Miami trying to get back here. I was visiting our Concord DA students out in Miami. So shout out to you guys and all of our lead assistants in Miami. And I was trying to get back. And I remember telling Erica, am I going to be able to fly back? Are they going to shut down this airport state to state? We arrived 7 days later, I think even less, we shut down offices, dentistry. Sitting on the board, seeing every office across the country, shut down and not be able to provide dentistry for patients. What are the next steps for us as dental assistants when we're supporting clinicians? And I think, PDS did a lot of things with that, Steve. And one of them was teledentistry, if I remember. And I think it got off in 4 days.
Yeah, 4 or 5 days, we were up and running. And there was a big hit then. As I was talking about it with the team, during the heat of the crisis, we were up to thousands a day of teledentistry. It's gone back to a trickle. As you know, we can't make Sarah crowns through the video, right? And so it's changed back, but it's a great tool still there. Tell me about what it was like, because you're right, it was March 16th. March 16th, we went to skeleton crews across the entire network of the PDS organization. What was it like for you as a dental assistant to work during that time and just help out everybody across the nation? Because we went to skeleton crews, people were nervous and all sorts of things. Talk about that.
Yeah, I'm not going to lie. And I was nervous as a dental assistant too. You're coming in, you don't know what's going on entirely with COVID. Who has it? Who doesn't have it? We still don't know that. I think what happened, what I'm so appreciative of, is we have our clinicians, we had PDS leadership team that were, in my eyes, what I'm learning from COVID: transparency, ongoing communication, and the collaboration is going to have to be there with us. Right. And that was everything from PPE, N95 mask and KN95 mask. We're going on the news that there's not enough. You're going to have to reuse. As a dental assistant in the PDS, team, we didn't have to worry about that. The N95 masks, surgical gowns, booties, bouffants, they were all there to help us support our patients and our clinicians. And that was the biggest thing and transparency I did when we worked with the dental assistants. The PPE is going to be there.
So let's hit on that for a minute. So during that crisis, there was a lot of fear, and yet when you were talking to it was probably 1,000 or 1,500 that were working during the peak of that crisis, right? How did they feel? Did they feel like they had enough protection? And I can give the answer post now, looking back 6 months, but during that time, talk about that.
Yeah, I mean, it's going to depend who you talk to in the market. Steve, you know that. I know for our dental assistants and the dental assistants I collaborate, inside and outside PDS, we did have the PPE. I sit on the board, so I also collaborate with quite a few clinicians that have their own private practices. And their dental assistants I work with very closely now with. And it was challenging for some offices to get the PPE. And that is what I think, I don't want to use the word fear ever, because we bought into the healthcare. Any patient walking into the office can have X, Y, or Z and not share it with us.
Anytime, right.
It happens. Right. And that was one thing that I really stayed focused on with our team, and making sure we have ongoing communication. And it's throughout the day. When we were in the peak of it, it was something can change that got posted in the morning at 6 o'clock East Coast time. By 12 noon Pacific time, the law, a new regulation, the healthcare department, something's coming in. So that communication and the ongoing text message. I heard from multiple dental assistants in the community that they hadn't heard from their clinician or their team about what was going on, but they were no longer working. And I think that's where the change has to be made. That ongoing communication with what is going to happen next needed to be there.
I think you hit on a couple things there. So number one is one of the things we did, and I know other big organizations did too, we went out and bought just a ton of PPE. We spent millions of dollars between March 16th and the end of the month to make sure you guys were all protected. So we had it available when I know so many smaller practices did not. I think it's another reason why large group practice is growing in America. There's so many reasons, but that's another one. We're going to get to the career path in just a minute. But another one is that dentistry is a safe profession, right? We know this stuff. And I kept talking to our team about that. We lived through the AIDS crisis in the late 80s and 90s. Many of us did. I know you were probably just being born about then, but many of us lived through that time. And dentistry, dentists, dental assistants, hygienists, they are exceptional at PPE. They're exceptional at staying safe. And the facts have proven that out. As of now, we've had millions of patients visits since that time, and we haven't had one transmission between a patient and a clinician, patient and a dental assistant, or a dental assistant and a patient. Now, we've had some transmissions, I call them break room transmissions, where people remove their mask or they weren't quite as safe, but we've had nothing serious around the company. But we haven't, in the operatory, you guys are safe, right? It's a safe profession.
No, and I think that's it. You have to know your donning and doffing process. And that was my biggest question to the clinicians on how are we going to train this down? So we have the PPE, the support is there, but now you need to train it down to every dental assistant and our DA students. Steve, the schools were running. The DA programs were in full swing. Kudos to them to going hybrid, taking their curriculum online, and then we needed to support them with externship and the hands-on. So we have to train it down on the spot when we're learning at the same time. So that's another thing, we really stress the process of revisiting the conversations with donning and doffing when it comes to compliance.
You don't normally think of that in day to day when there's not this this pressure of this coronavirus, this pandemic going on, but really we should be doing that every single day, right?
Absolutely, from start to finish. I mean, you saw me and Bree, we're right here 6 feet with each other, and we have our masks on. We're working with each other. Those are basic things that have to be done to ensure the safety of everyone in the practice and our families at home. It goes beyond that.
Yeah, so I think part of this, the message is, hey, dentistry is a very, very safe profession. Dental assisting is a very safe profession, and we know how to stay safe. So I just want to make sure that message is loud and clear.